right. Hi, everyone. Welcome back to another episode of Heart to Heart. This is a IGTV and now newly branded YouTube series started by myself, Dr. Breen Mohammed, and my partner in crime, Dr. Misha Gupta, where we talk to today's physicians about their journeys through medicine, their social media presence, and really just learning about them as people. So today we are incredibly fortunate to have Dr. Brian Lima. He is an accomplished cardiothoracic surgeon, initially graduated magna cum laude from Cornell, received his medical degree as well as his surgical training from Duke University and his cardiac surgery training from Cleveland Clinic. Currently, he serves as director of the cardiac transplant program at Northwell Health in Long Island. He's received multiple awards of excellence, has published over 80 journal articles in peer-reviewed journals, and has presented and lectured at multiple national and international conferences. Not to mention, he is also an accomplished author of his book, Heart to Beat, where he shares his own personal journey of success. We are so incredibly fortunate to have you today. Thank you so much for joining us.
Thank you so much. It's great to be here.
Of course. So to get started, and of course, you know a little bit about this from your book, but share with us a little bit about your journey through medicine and what ultimately led you to a career in surgery and cardiothoracic surgery.
So I had no idea why I wanted to be a doctor. It just sounded cool. Then I watched my first surgery. I was doing a pre-med program in college. It was summer between my junior and senior year of college. I was applying to medical school. Wow. And I really actually was at a loss why am I going to say I want to be a doctor besides it sounded like awesome or something like that. So, and I watched my first operation. That was it. I fell in love with it right away. Just my eyes were like as big as saucers, and I just 4 hours went by like this. And I was like, that's it. That's what I want to do. Wow. I don't care how long it takes. I don't care how painful it is. And then I also loved I had tried to be a football player. That was actually plan A. My first love was football, and that failed miserably. But the surgery culture reminded me of like football practice and like the meathead jock kind of culture. It's not really a resounding endorsement of surgery, but it just sort of reminded me at the time. And I was like, I kind of felt a familiarity with that, like, tough love and you got to have thick skin and all that. So that's sort of what initially got me into surgery. And then it evolved from there into heart surgery. Because again, it was one of those things, seeing a heart and the skill required, the amount of time I was just so drawn to it. And I looked up so much to the people that were doing it that I just was convinced that's what I wanted to do.
Absolutely. Yeah. I think, you guys, CT surgeons, especially the transplant surgeons, are a very, very small, a group of specialized surgeons in the country and in the world. So, all of us, especially us as cardiologists, and Amisha's a pediatric congenital cardiologist, I'm an adult cardiologist, we obviously look up to you guys so much and are so grateful when, we're able to work with you and help these patients. I want to ask, what was it like when you did your first cardiac transplant surgery solo? Was that a big deal for you? Probably,
huge,
right?
Huge deal. It's just never gets old. It's one of those things where you've seen it so many times and then you see it and the heart just knows what to do. It's just one of those things, like you just make the connections. You're like, I hope this works, and it always works. So it never gets old. I love it. And obviously it was a special moment the first time, I was entrusted with doing it solo on my own with no one else to, sign my name under, it was just me. But thank God it went well. So here we are.
Oh, God.
Yeah. Actually, one of my first exposures to cardiology was a cardiothoracic case when I was in high school. So, when you talk about that feeling you got from your first case and kind of the exposure to it, it just brings back my own memories of, just getting excited to see this pumping organ of life, and what the surgeons, can do with it. So I think sharing your story, it helps our audience, and it helps, I think, the general public see why we're so passionate about our jobs. And, you're such an incredible inspiration, and your book, Heart to Beat, highlights your journey. What compelled you to write the book, and why do you think it's important for physicians to share their journeys and their personal struggles with everyone?
I think writing the book was part of the trajectory that I was on, where I really felt like there wasn't, there's a lot of folks out there, not to name any names, that are peddling like these home remedies that are unproven, but there's really no one out there that comes to mind or came to mind like us that do every day in the trenches medical care and shares that with folks, out there in the community. And so there's so much so many things that we do day in, day out that we take for granted that are really amazing. I mean, how long did it take to learn, the reps it took to, effortlessly do the things that we do, whether it's knowing what medication to prescribe, the judgment it took to do that, or the surgery, all those things. And so I really wanted to get that out to the public. And I felt, it started with just, social media stuff, and then it culminated into this book, because I also wanted to get my story out, because I felt like my story, even though it is, I'm a physician, it's not specific to, that's just the backdrop to my specific story. But I think it's a story of, things aren't easy. You have to overcome challenges, universal themes of grit, hard work ethic, and, being an entrepreneur, which was the total surprise, which I never expected or saw coming as a medical student, that I would have to actually build a practice and interact with others to convince them to send me, you could be the greatest surgeon in the world, but if none of the, your cardiology colleagues like you or think it's really painful to work with you, you're not going to get any patients. And so how do you, work as a, in a team? How do you get other people to buy in? And there's so much of that I had to learn out in the field from scratch. And so that's part of other issues that I discuss in the book too.
Yeah, I think, and we were talking about this before we started recording, but there's so many things that we don't learn in school that we may pick up through training, but it's these like interpersonal skills that you talk about, this camaraderie, kind of learning how to become the physician and the person that we want to for our patients, but also how to work within a system, like you said, as a team. So I think, having you publish that and talk about it, especially coming from where you are at, in your specialty, I think makes a difference, not only for students and trainees, but for the general public to hear those stories as well.
Yeah, and one thing I always get on this soapbox about heart failure too, and I do touch on heart health at the end of the book, in the final section. But, folks hear cancer or suspicion of cancer, and immediately it's like, okay, doc, what do I have to do? Or on the referring physician side, they're like, okay, this is a possible cancer. It's all protocolized, right? Mm-hmm. And my frustration as a surgeon that takes care of folks with heart failure is it's the opposite in heart failure. You got a little bit of, a whole smattering of different kinds of physicians that take care of heart failure or think they can take care of heart failure. But it's almost like waiting till someone has metastatic cancer before referring them to an oncologist. How outlandish would that be, right? We would all be up in arms. That's business as usual every day in the heart failure world. We, more often than not, we wait till the 11th hour to refer these unfortunate patients for advanced, heart evaluation, and it's too late, all right? And so I touch on that too, because it's such a, subject that I deal with all the time. That's frustrating, and I wanted to also help save lives, just promoting awareness of that fact too. So it's another important issue.
Yeah, I feel you on that, because it is very frustrating. It's frustrating for us as, cardiologists, obviously frustrating for you guys as surgeons, obviously for our heart failure colleagues that, they should have a lot more patients referred to them at an earlier stage to help manage their, heart failure symptoms. And that's actually been proven to be more beneficial for outcomes for these patients. And unfortunately, we know the standard of care, right? Beta blockers, ACE inhibitors, all of these things. And now with these new studies with the, the diabetes medications, aldactone, which is significant. I'm not trying to make this into a medical talk, but I'm just saying that right. These medications are so incredibly underutilized. And it's just unfortunate, because I feel like people can just have much better outcomes with just a little bit of a tweak of, this or that. And yeah, trust me, I feel you, because I deal with that on a daily basis. I'm sure, Amisha, even with your pediatric colleagues, you probably deal with that on a daily basis.
Well, I think it's also with our, transition of care, right? So you won't get too deep into the medical logistics of everything, but I think it's, since we're talking about public health in this in this issue, it's important also for transition of care and to, I think, really analyze these situations, right? From, everyone has their specialty and everyone kind of delves into that. But this goes back to what you're saying, Brian, about kind of these interpersonal skills and building relationships, because our patients, being from the pediatric and the congenital side of the things, this is lifelong illnesses, conditions, diseases that they're dealing with. So they really need advocates from a whole team. And we need our teams to be talking to each other about best care and best practices. So,
absolutely.
Yeah.
So, Brian, just to go a little bit forward or moving forward, obviously we see that you're a big hit on social media, especially Instagram, and you've definitely, been on several news outlets and you have some experience with other media platforms. So how were you initially able to get started with the media and on social media? And what advice would you give to students, trainees, and even early career physicians in whatever specialty they are, if they have similar aspirations to be like you?
Well, it wasn't until I embraced the concept that, like it or not, I'm a brand. We're all brands in one way, shape, or form. And it really hit home when I entered the workplace. My first job out of training, I thought, hey, I trained at all these really great places. My OR schedule is going to be booked way in advance. I'm going to have patients waiting in clinic. And it was like, crickets. And I'm like, what's going on? And it's like, and so when that clicked and I started to realize, okay, what do I have to do? And that's when I started to understand, well, I'm a brand. I have to market my brand. I'm just a new, entity in the work, force in this market. And why are people going to send patients to me? What's so special about me? They've been sending them to another surgeon for 20 years
Right.
and things have gone okay. So how do you, so once I embraced that, then I went to just starting to share things that I do. We all have, it doesn't have to be razzle dazzle, crazy open heart surgery. It could be everyday things that a physician does matters, and sharing it in some way, testimonials from patients. So getting into routinely consenting patients and involving your admin into, hey, we need to promote the things that we do, because that's how the public is going to understand that what we do matters. And that's also how you start to develop a presence and people become aware of you in your local market and then even beyond. So that's how you can build referrals. So I started really from that point of view through Facebook initially. And then once the book idea came into play, then I had to get PR. So unfortunately, that's an investment as well. But I had no idea how to do these things, how to get, there's all a network, right? It's all this whole other world that exists that I was oblivious to, that most of us are oblivious to. And this is just another day at the office for these people. And they know how to network and get into these different channels, how to get you, quoted in a US news article or quoted in about a study in cardiology. And there's studies that come out in our fields every day or weekly. We as part of what we do as physicians, we routinely, comb the literature for our respective journals, and we kind of internalize that. But why not share that with the public? Say, I'm a cardiologist. This is an important study in cardiology just came out. And so I started doing a lot of that, and it just sort of snowballed from there, halo effect, and then you start to become familiar, and people will look at you as that source. So I encourage people to just be outgoing. No matter how great of a physician you are, no matter how impeccable your pedigree is, doesn't matter. Really, at the end of the day, it matters how you interact with people. Do people, want to send patients to you? And once you embrace that, I think you really start to understand how to work the whole process.
Definitely. I think, that's important. You said that it's about building a brand, right? And so, whether that's like marketing yourself to the public, to a company, to your hospital, I think that's important as we go forward, not to ignore, right? That these sources, these media sources, these other networks that you've tapped into, ran rounds and we do all of those things from a clinical perspective, but the business side of things, and sometimes people don't like to hear the word business with medicine, is important for career development. So I think, all of us can learn from you in that realm. And, kind of going with that in terms of like branding yourself and making yourself more known, I think, especially in the field of surgery, what it has been known for is being a little bit notorious for not including certain populations, or at least being selective, right? So it's been known for being a male-dominated field, and especially cardiothoracic surgery, and in my realm, congenital CT surgery. So there's, I think, very little women representation in that. So, being a leader in your field, putting your face out there, how do you think we can be more inclusive in surgery and CT surgery, and really open up the doors of diversity for your field?
So I'm glad you asked that question, because that's also a huge motivating factor for why I wrote the book. I come from I'm a first generation Cuban American. So my parents, my two older siblings came over from Cuba, and we were bottom of the barrel. I mean, low income, lived in an apartment, scraping by. I had zero, role models. The only Cuban that I could point to out there was like Tony Montana and Scarface, growing up. I had like no role models that I could look to, right? So yeah, I'm huge about being inclusive in underrepresented populations. In STEM, there's very, very low representation of minority populations in science and engineering and math and medicine. And so I'm all about promoting that aspect, kind of like, hey, if I could do it, you could do it too. There's not many, Latinos that do what I do, and I had to scratch and claw every way. It wasn't easy, but here I am. And so I think the more that those of us that are from underrepresented backgrounds sort of promote that aspect too, so that somebody from our own, where we grew up, or from our same ethnicity or our socioeconomic background, can say, wow, okay, because people do just look to social media. And that's the other problem. That's the dark side of social media. People look to that as their role models, and and that unfortunately is littered with overnight success and flashy things, and I want it now. Delayed gratification is like a has-been type of So that is really, really important. It behooves us to do that, to say no. This is the right way to do it. There is something to this whole delayed gratification thing. And that's also something that drives me a great deal.
Yeah, absolutely. And it's so great that you advocate for diversity and inclusion, because that's honestly one of the reasons why Amisha and I wanted to start this series, is because I just feel like when people see representation from different backgrounds, whether it be women, which initially we wanted to start this series because we were like, there is a lack of women within our field, but then broaden that to surgery and other specialties, and you just see a lack of diversity in all realms. Maybe percentages might vary here and there, but it's important to talk about. So when people see people like us and say, oh, well, if this person can do it, I can do it too. Or if, this guy could do it, I could do it too. And not just from, different racial backgrounds, but like you said, socioeconomic backgrounds, we already know. And this is this has come up a lot, especially over this past year with, the pandemic and all of these disparities that have come out, that people from different economic backgrounds, especially lower backgrounds, they just don't get the opportunities, and if they were just given the opportunity, it doesn't mean that there's a difference in intelligence or anything like that. These people are really smart people, a lot of them, they're just not given the opportunity, so we want to be able to encourage everyone to show them that we all have different backgrounds, and if we share our story, maybe someone can relate to that and be able to say, hey, if they did it, I could do it too.
Definitely.
Yeah. Well, Brian, it's been amazing having you on. I
Thank
think
you.
that our audience especially really enjoys hearing about everyone's journeys, all of our guests' journeys. And I think it's very important to hear from someone like you, right, about representation, about what steps you took, about, hearing the difficulties that you may have had to face, which go read his book. You can hear about all of them in there. And then also just seeing you, right? Seeing you on a platform like this, being an advocate for yourself, for people who look like you, who are like us. I think it's so important. So thank you again for joining us today. Is there
My pleasure.
anything you want to leave our audience with?
Just keep your head down, work hard. This too will pass. As long as there's nothing special about the people that came before you. You know, if other mere mortals could do X, Y, Z, so can you. It's just a process. It's just about getting the reps, getting the experience, and you can do whatever you set your mind to. So don't never give up on your dreams.
Absolutely. Hard work, passion, and never give up on your dreams. So thank you so much again. And to
Thank
all
you.
of our audience, we'll see you next time on the next Heart to Heart.
Bye, everybody.